Wilder is very unique as a human service organization in that we have both research and direct service programs. And you don't see that a lot around the country even. So being a community-based organization, we get to work together to help make a bigger impact in our community and statewide.
And we know that families not only experience homelessness as children experience it as adults, but we also know that our system is designed that families have to lose everything before they can actually gain access to resources.
So Wilder coordinates the homeless study, but I would never say that we do it alone. So we really can't do it without partners throughout the state of Minnesota. We have over 350 organizations that we work with across the state, as well as people who are working with people who are staying outside or in unsheltered situations. So when we first started doing this study, people really looked at homelessness as an individual problem and individual issues that brought them into homelessness. And now I think we really look at homelessness as a systems issue. It's about affordable housing. It's about all sorts of barriers to people getting stable housing. So we're really hoping the impact of our study this fall is to come up with solutions, either at the program level or at the state level or even maybe nationally to help solve homelessness for our population. I've been really lucky to be able to work with Wilder's Housing Services over my career, starting at the very beginning with some really great partners like Antonia.
One example of how we utilized evaluation to pivot the program would be that we received multiple examples of families being denied because they did not qualify because they received a rental subsidy. So the impact to that is that we were able to get more families qualified, and we've even had some families that were able to and willing to give up their subsidy to actually be able to work towards home ownership. We know that collectively, if we continue to work together and use our voices to amplify what is actually happening on the ground, that we can be the change that is necessary to not only reduce, but continuously just get rid of homelessness as a whole.
Yeah, I love that.
It's so crucial to elevate client voices. I mean, our work is about the client. Our work is about their health and their wellness. And so to be responsive to the customer walking in through the door means that we're hitting the target.
We're currently piloting an approach where we're gathering information from mental health clients on a more ongoing basis as they're receiving their services. In some cases, we're doing a paper and pencil survey. In some cases, we're doing an online survey. In some cases, it's a phone survey. Sometimes it's face-to-face. We're also changing the languages in order to have linguistically matched surveys to reduce barriers to authentic engagement. And so we ended up translating the survey, including a meaning-for-meaning translation rather than a word-for-word translation, into 5 different languages.
I think partnering with Wilder Research makes us a better service provider on many levels in community mental health and wellness. Not only do we get more specific, actionable information to take care of our clients, but when you really think about it, a survey feels kind of impersonal, but these are really personal services that people are asking for. They're one-on-one intimate relationships where people are pouring out some of the hardest things in their lives. They're coming to us at a vulnerable time in their lives, and this is a way of honoring them by checking in to see, are we delivering the services that we said that we were going to deliver in a timely way, in a compassionate way.
Having programs alongside Wilder Research is one of the most fantastic parts of the Wilder Foundation. It allows us to learn from each other and work together in a collaborative way, and it gives us the ability to access the individuals that are being served in a much deeper way.